Hello everyone, my name is Maharlika Diarse. I'm going to be doing oral medication administration skills video. This is my remediation skills video. Um, so before I start, I have my Nightingale scrub top, Nightingale scrub bottom, um, Nightingale badge. My hair is tied back, it's not in the way. I have nothing on my nails, no jewelry, no nothing. Um, this is my gloves, gauze, Tylenol liquid, water bottle for the patient, and two medicine cups. Also, since this is my skills video, I am some of the the medications are open, and also there is no DocuState sodium in the package that we got. So I'm just going to pretend that one of them is DocuState sodium, and these are three of them are open. And of course, in the real world, I'm always going to make sure is it a right drug, and it is unopened, and that would be a safety issue, you know. So just pretend, just for skills video, everything is unopened and new, and it is the right drug. All right. So before I begin, I'm going to verify the provider's order. The provider's order is at 0900, and the first one is DocuState sodium, which is Colace, at 100 milligrams. Warfarin, which is Coumadin, it is at 5 milligrams. Furosemide, Lasix, it is at 20 milligrams. And potassium chloride, it is known as Kador, 20 MEQ. Acetaminophen, liquid, 500 mg or at 15 ml. And that is the provider's orders. And before I start, I'm going to excuse my stuffy nose. I'm going to verify my 6 rights: right patient, right route, right drug, right dose, right time, and right documentation. And then of course, we need to do any dosage calculation. We're gonna do that right away, but in this case there's no dosage calculation at all. Everything is correct. I have the right drug and right dose. Perfect. So so now I'm going to take all my supplies. I'm going to knock on the door, provide the privacy curtain, place these out on a flat surface, a little bit away from the patient. I'm going to wash my hands. All right. Hello, Miss Smith. My name is Maharlika. I'm going to be your nurse today. I'm going to be giving you your oral medication that your provider has ordered for you. Alrighty. Can you please verify your name and date of birth? So I'm gonna take this opportunity to verify her name and date of birth, her wristband. And now I'm gonna just check on the EHR, MAR. Everything's aligning right. All right, and the medications, everything's right. Alrighty. Miss Smith, do you have any allergies? Any food or medication allergies? No, Miss Smith. All right, perfect. So I'm going to wash my hands again. So I'm going to begin and wash my hands. Now I'm going to put my gloves on. Why my glove is acting up? So I put my gloves on. Alrighty, Miss Smith, I'm just going to compare all these medications again on the EHR, just going to make sure everything's aligning right, everything's right. This is Miss Smith. Alrighty, Miss Smith. So before I give these medications to you, I just want to make sure that you are in a comfortable position, and she's already sitting upright, 90 degrees on the bed. Everything's right. All right, Miss Smith, are you comfortable? Alrighty. So Miss Smith, before I give these to you, I just want to explain what these are and what these do, and also side effects and the adverse side effects for these medications. So the first one is the tablet is Docusate Sodium. It is 100 milligrams. It is also known as Colace, and it is a stool softener. And one of the side effects are nausea and vomiting. Adverse side effects are stomach pain or swelling of the face. And also the second tablet is warfarin, which is urcumidin at 5 milligrams, and it is a blood thinner, or it can treat your blood clots, any blood clots. And the side effects is stomach ache and diarrhea. Some adverse side effects are excessive bleeding or vomiting blood. We don't want that. So if you're experiencing any of these, let us know. And your third tablet is furosemide, which is Lasix, 20 milligrams. I'm sorry. Of course, if I'm not feeling well, I would not come to work. Sure have sick hours, and just to not spread any infection or anything that I have. Alright, sorry. And then, so that was furosemide at Lasix at 20 milligrams, and it treats your high blood pressure. It is also a diuretic. And some side effects are headache, dry mouth, and adverse side effects are dehydration and irregular heartbeat. So your fourth tablet is potassium chloride. It is also known as K-Dor at 20 MEQ, and this prevents and treats low levels of potassium. Some side effects are stomach bloat and vomit, and some adverse side effects are chest pain and irregular heartbeat. Your last one is acetaminophen, Tylenol. It is at 500 mg or at 15 ml liquid, and this treats any aches or pains and reduces fever. Some side effects are nausea and stomach ache, and some adverse side effects are blistering skin or difficulty breathing. Alrighty, Miss Smith, do you have any questions for me? No. Alrighty, if you are going to experience, or if you're going to experience any of these side effects or adverse side effects, please just call us right away. We will be right here with you. Alright? Alrighty, so now I'm going to begin. Med cups. So the first one is Docusate Sodium. I'm going to put it into here. Docusate Sodium. I'm going to pretend my trash is over here. Next one is warfarin sodium, which is Coumadin. Rip it up, put it in here. Alrighty, your next one is furosemide, which is your Lasix. I'm going to rip it up and place it into there. Alrighty, so, and your last one is potassium chloride, K-Dor. To pretend that this is new, and I'm gonna rip it up, put it in there, put it in the trash. Alrighty. Since Miss Smith is already at a sitting position 90 degrees, for water, Miss Smith, so some of the providers would let the patient take their own oral medication, but at this time, she wants me to do it. Alrighty, Miss Smith, here are your 4 medication oral tablets. Alrighty, here we go. She took it. Throw my sink cup away. Alrighty, Miss Smith, here's some water. Alrighty, perfect. Just drink some water. Alrighty. Miss Smith, can you just open your mouth? I just want to make sure that you swallowed it right. Alright, perfect. So she swallowed it. Alrighty, Miss Smith. So now we are going to do our acetaminophen, Tylenol, 500 mg or 15 ml. So let's put this over here. So I'm going to make sure that before we open it, I'm going to shake it up a little bit just to make sure that everything's distributed right. When we open it, we don't want the liquid medication to be falling onto the cap. So we're going to make sure that we place it like this onto the table and make sure that I'm holding the bottle right, like holding the label, so in case the liquid medication goes onto the bottle, it'll go on my gloves already. So I'm going to do 15 ml and to make sure that it is 15 ml. Already perfect. 15 ml. Before I close the medication, I'm just going to wipe the lip of the medication bottle, throw this away, and then I'm going to close. Store this away for later use. I'm going to store it away in a safe place for now. Just put it over there. So this is 15 ml. I don't know if you guys can see it, but it is at 15 ml. Okay, it's 15 ml. 15 ml. Alrighty, Miss Smith, this is your acetaminophen, your Tylenol liquid. Alrighty, here we go. Alrighty, Miss Smith, I'm going to throw it away, pretend. Alright, Miss Smith, here's some water just to flush it down. Alrighty, Miss Smith. I'm going to put this here in case you just want some water later. Alright, Miss Smith, do you have any questions for me? No? Alright. Again, if you're experiencing any side effects or any adverse side effects, just please let me know. Please let us know. Here's your call bell. And are you comfortable at the position you are in? Alrighty. Everything's good. Everything's locked. Here's your call bell, Miss Smith. So, now I'm going to take off my gloves. Throw it in the trash bin. I'm going to not wash my hands yet. I'm going to wash my hands. Undo the privacy curtain. And then I'm going to wash my hands. And then I'm going to document my findings. And that's it. Thank you so much. Sorry for my stuffy nose.